That's what I told. Ayurveda always focuses upon metabolic corrections, not
Hmm.
the calorie countings. That's
Hmm.
what. Right. It's not about the
Hmm.
calorie counting, how much calorie you are eating. It's not about that. It's just about the metabolic corrections. Metabolic corrections means the key principles again comes like strengthening your digestive fire.
Hey there, if you're curious about Ayurveda and want to learn more about balancing your body, mind, and spirit, tune in to Srishti Ayurveda podcast. Join me, Dr. Srilakshmi, a confused VAMS graduate, as we dive into the world of Ayurveda, exploring topics like dosha, natural remedies, self care, and so much more. We'll also be busting some common myths about Ayurveda and gaining facts to help you separate truth from fiction. From practical tips to expert insights, Srishti Ayurveda has covered it all. Subscribe now and get ready to nourish your wellness journey. Hello everyone, welcome to second episode of Srishti Ayurveda. Today we have a familiar face with us. We have Dr. Ankush sir again. Dr. Ankush ji is an MD Ayurvedic Swasthavrita assistant professor and wellness educator dedicated to promoting preventive healthcare through Ayurveda, diet, and lifestyle management. He actively engages in teaching, research, media programs, and public education to bring Ayurveda closer to everyday life. I think this bio will be the most apt to talk about you because today's topic, who have listened to our first podcast will know we kind of mentioned it there, or I should say, it was inspired from that podcast itself. It's Ayurveda from brush to bed. When you talk about Ayurveda, it is not just a medical science or it is not just for, treating diseases. It's also for preventing before it happens, or it is like a science or a science of living, how you should live your life so that you can, prevent the diseases that in the foreseeable future. So in that matter, I think Ayurveda is far ahead. So how do you, sir, how do you describe Ayurveda as related to daily life from as the title says, from brush to bed?
First of all, I would say that that word itself is very catchy. From brush to bed, right? It's good and it sounds very nice also. So, and these two things are very important things in our daily basis also. Brushing and get into bed. Ayurveda is fundamentally a dinacharya based, I may say, like life science, which is very close to the daily regimens. I don't think any other science is so much close towards these type of daily regimens. So the classical text in Ayurveda, whichever you can take, like Ashtanga, Hridaya, Sushruta, or Charaka, whatever the text are. So there we could see the first prima facie chapters always will be dedicated towards these daily regimens. So we can also concisely we can say that Ayurveda always emphasizes predominancy of these daily regimens in its primordial phase itself. Whether it's disease or whether it's life or whether it's starting of a day, whatever it is. So daily routines always plays an important role. Let's think about modern science. There was a study
Mm,
which was conducted by WHO in 2023, which emphasizes that 70 to 80% of total preventable lifestyle diseases are linked with our daily habits, especially our sleep or with our food or timely feeding, we can say, or with our oral hygiene and more important, stress. Now we can link this particular aspect with Ayurveda. So
mm,
daily regimens starting from your bedside, how you are waking up, what all things you are doing, how you are brushing, how you are voiding your things out properly. And after that, how you are maintaining hygiene. Then towards your fooding. Then when you have to take the food. Then after that, which all time is necessary to take the food. Then when you go to sleep. So Ayurveda always insists three pillars which are very essential for a human being to have in life. It's known as Trayopastapa, three pillars. Ahara,
mm.
Nidra, and Brahmacharya. Brahmachari is
Right.
nothing but it has so much of things. I think we will discuss in detail in coming sessions.
It has a more deeper layer, not just the
Yes,
word
of course,
brahmacharya.
it has a deeper layer. So See, what I was trying to say is 70 to 80% of preventable lifestyle diseases are being caused due to these things. It's not roughly said. You can Google or you can go to WHO site. In the year 2023, they have said it. So see how versatility is there when we think about Ayurveda. During that time itself, they could have understood it. So
Hmm.
bringing or saying that dinacharya daily routines, which starts with Brahma Muhurta, that we have said in the previous podcast also, that what is Brahma Muhurta? So preferably the time just 1.5 hours prior to the sunrise can be claimed as Brahma Muhurta. That means you just think nowadays the signs have uh, evolved in certain ways that they also said that the circadian rhythm, which starts with cortisol peaking and also alertness, by the time just above 1.5 to 2 hours prior to sunrise. So, see how cortisol can work towards our body enhancements and also the alertness that will create. So, a person
Hmm.
who just wakes up at this particular time with these sort of gratefulness of having these high cortisol level and alertness, both body as well as their mind. Starting with that pace is super. So that's why Brahma Muhurta has that much importance, I may say. And coming to next about Dinacharya, the second perspective is about food. That means Ayurveda, we can say it as Agni. Agni is nothing but the strongest period of Agni is the ideal time for digestion. It's always starts from 10 a.m. to 2 p.m. That time period is the ideal time to get in to get digested the food that we ingest. So Agni must be very strong and also just see the last one, that is our sleep. The melatonin rise in our body induces sleep. And according to the modern science, the app time of melatonin rise is from 8 p.m. to 10 p.m. So see, Ayurveda also insists us to get proper sleep during this particular time itself. So it's so important for the people to understand it. Why? In order to get a better life. So that's why
Hmm.
I have told that Ayurveda is fundamentally a dinacharya based life science or daily regimen based life science. It's very important for us that Ayurveda is not a episodic treatment or Ayurveda. It is
Hmm.
a moment to moment health management we can say. So for that, this dinacharya, early morning, waking up, having sipping some sort of water after that, it's known as ushapana, early morning drinking water, we can have it. And after that, we are brushing it, that too with certain tweaks that's commonly available and that has so much of taste difference also that will cleanse your gums as well as oral cavity because digestion starts from oral cavity. So from that itself, the purity is being coming up. Then you
Hmm.
are going to void, and after voiding, you will again come up and you will have some massages with oil that will three place at least when you have no time management. You can at least utilize your oil in the ear or on your head or on the palms or soles also. At least in these three places, you must apply oil. It's known as abhyanga. And then you are eating when you have hunger or when you are feeling hungry, I say. Then you are going for sleep, a better sleep. So see, from starting from morning till evening, what all things are being done. It's in a slow pace, it's going, but it's steadily, it's been going. That's why it's not an episode. It's a moment to moment treatment or health management, we can say. So that's why this Dinashari is very much important. It has lots other concepts because in concise manner we have to say to the people so that they will understand these things. That's why I'm saying like this. It has lot more things because it's not only life management or health management. When it comes to disease, these things will alter. These things are told to a healthy person, not to a diseased one. So according to the disease, these things will change, of course, because disease condition is very different. So dinacharya, particularly or prima facie, it's being told for a person who is healthy and how he can continue that steady healthy state. So that's very important for us to understand that yes, dinacharya is being told to a healthy person, not to a disease. And according to
Disease person.
disease, we will alter those things.
Basically, it is a guidelines that has been set, which you should alter according to the patient's health. If he's
Yes.
healthy and can follow it, they definitely follow it to the T. And if they are not, then it should be altered according to the patient's condition.
And also looking at the 10 different factors which have been told in Ayurveda, like the place where you dwell, your body
Hmm.
alignment.
Exactly.
Desha, Dusha, Balam, Kalam, Prakriti, Analam, Sattam, Sattvam, Maharam. These things are also be taken in care. Then only we will
Hmm.
do it. See,
Hmm.
just when
Hmm.
you go to some Mediterranean countries and you are saying that you must wake up at bed 4:30 or 5:30 and you must have a bath means it's absolutely something ridiculous we can say. So
Yeah.
we have to think about the place, not only Mediterranean countries. Let's go to some northern parts of our country nowadays. It's being so cold. So
Yeah.
align with the desha, align with the
Currently now
dusha.
I'm in Delhi and I can't think of waking up at 4:30 or even one. Like I hardly see sunrise these days.
That's what.
December in Delhi, I know how can everyone can see, and you are in Gujarat, so I think it's the same thing there also. It is such chilly mornings that waking up at Brahma Muhurta is kind of seems impossible. And so according to our Desha, we have to alter it.
Sure, 100%. That's what Ayurveda always insists. Like we said, it's a personalized science.
Yeah.
We can do it.
I think it's one of the greatest things of Ayurveda. I don't think any other science is that much customizable. It is individualistically how we can customize for each and every person. I don't think any other science does that.
So true. It's so true.
So, yeah, as you were talking about a lot of things which comes under dinacharya, you were talking about how the brushing is important, the avoiding is important, how to eat when you're hunger. I am a strong believer that Ayurveda has a lot to do with your gut health
Wow.
because, as we said in the previous podcast, Ahara is Aushadha. When you're talking about what you put inside, it is also important how the cleansing process of your body is. So, what do you say that importance of a clean bowel is? Because nowadays, in OPD also, I have noticed that a lot of patients say that no, so, like early in the morning, it doesn't happen. I have to either go for a walk, have a cup of coffee, or have something else so then my bowel starts moving. So, what do you think? How important is bowel cleaning in the morning?
Yeah, of course. The clean bowl, or also we can say as Malashuddhi in Ayurveda, is a very important aspect. And when we think about this, we have to quote one particular aspect which Acharya is always saying. That means all disease begins with poor digestion. So
Mhm.
whenever the disease aspect comes, you must see about the digestive aspect also. Nowadays, the world is proclaiming about the gut brain axis and all those things. So I may say, whatever things when we say as disease is due to poor digestion, what do you eat? So, saying about that one, we can say that the modern studies shows that the gut dysfunction is linked 70% with immune activities. 70% it's linked with your immune activity. So, constipation, and we know that when constipation comes, there's a lot more risk towards so much of things like IBS. It's been told that if you have constipation, the risk compared to a normal person is 2.5 times than a normal one to get IBS. And when it comes to
Okay.
metabolic syndrome, it's around 1.8 times. See, the modern science also aligns to these type of things. I may bring to your or to the all our audience that there is one misconception in our fooding nowadays that whenever we eat or whenever we perceive from other countries is good. For example, when we go to certain places like our Kerala, you could see n number of oil freight shops throughout.
Hmm.
That too, within a locality of 1 kilometer, you may find more than 10 shops which just sell these oil fried like vadas, pavs, and all those things. Not only in South India, when you come to North India, also these things happens. But
Yeah,
precisely
it
why
is,
I'm saying
if it
South
is parota in the south, it is parathas in the north. That is creating the issue.
we have to think about the geographical condition of the south also. It's not cold or it's not hot that much as north is concerned. So
Mm.
in that particular temperature where the people are not feeling that much hot or that much cold, there also you are eating something which is not suitable for your body. That too after deep frying it for 8 or even 100 times.
Mm.
So when a which is being, there are proportions for oil to get cooled and to get hot. So it integrates the chemical constitution of all those things. How many X times
Mm.
we just fries those things, that much times we are getting. So
You're saying that if like a traditional food, when it like I'm from Kerala, we both are from Kerala. So if you take our traditional food, it is mainly steamed items.
yes,
Has it been idli, put, or even the anything that is made at home, it is made with less oil. That is because in our desha we don't feel that much cold, and according to our desha. But when porota and shawarma came into play, it kind of disrupted the ecosystem. The northern states, where it is colder in the winters right now, like in both our localities,
yeah.
it is colder. So the- since you're here, if it is okay for you to consume in a good proportion, not like every day having it, but like sarso ka saag and makki ki roti is okay for you to consume in this weather because that weather is made for that. So that is the traditional food that is prepared here during winters only. So I think Ritu also plays a bit of a role in this food habits of in South India.
Ayurveda considers this bowel regularity marker, we can say, with three things. One is you should have a proper balanced vata.
Hmm.
Second one is you must have a proper digestion, that is Agni. And third one, you must have a clear shoulders, or we can say channels. Channels in Ayurveda is shoulders itself. Vice versa, we are thinking that if you have proper regularity in bowel, it will balance Vata, it will
Hmm.
properly enhance your Agni, and it will get into your shoulders for sure. That means your channels are get proper. So if these markers of Ayurveda have been greatly emphasized by the food or by the bowel or by your gut, then you will not be diseased that much. So this gut plays a very, very, very important role so that at least once daily you must go for get rid of your bowel. It should
Hmm.
not have a strain, and we must feel that complete evacuation have happened, and also no foul odor or any mucus or mucilage systems should come out when you void.
Hmm.
So if these things are
And you
there,
should also feel satisfied at the end. Like some patients say that.
satisfaction is the key for that. If you have a proper gut system, satisfaction will be there. That's why when you think about IBS, what the patients feel is, yes, I must go. I am feeling to go. And where should I go? How should I? And always remember, when you eat certain food like the red meats for a particular interval of time, no, what it really happens is it tends you to have IBS or even more complications like cancers if you're regularly take. So that's what I said. Regular intake of these things always will make you to feel diseased because your mind is
Mm.
not completely evacuated. So that sort of feeling, that good feeling should come. Otherwise, it will lead to IBS. If it's not treated, of course, there will come certain very fatty diseases.
Understood. So, what would you say your go-to Ayurvedic hack is to, improve the digestion so that bowel evacuation is better or anything for a swastha? Obviously, for a atura, we'll give the medicines according to that. But for a atura means a patient. But for a swastha, what will be your go-to Ayurvedic recommendation?
So first of all, what we have to do is after getting up from your bed, you must have a bit of water. Early morning, you must have ushapanam around 6:50. tea into around 850 ml of water. You just take it and just boil it and keep it either in your mud pot or in a copper vessel. But always remember, when you keep it in copper vessels, every day you should clean the copper vessel and you should keep it. Otherwise, it will be better for you. That's what we are not concerned about. When we say that Ayurveda and when we say that we must keep in this, we must keep in that, we don't say or we don't appeal to the public that you have to clean this. There are certain methods by which we have to clean it, then only we have to keep it. We also know that if you are not cleaning it properly, then it will cause some other things also like cuprets or some cupric things will come and that will be fatal for you also. We all know that one.
So the copper will leach into the water.
Of course, 100%. But good copper is very good also. That's why cleansing the copper, just take some tamarind. Just take a bit of tamarind, put it in water, and just take a cloth, like a cotton cloth, and just rub those vessel very thoroughly. It will be cleansed. So keep it either in mud pot or in copper or in silver or in gold for one fortnight, and the very next day you can have it. This is the first one great thing that you can do so that your bowel is clean. You will be get rid of certain diseases which may cause uh, herniations or which may cause like piles, fistulas, and all those things. No, it will be cured off. Second thing, what you have to do is take some warm water, not boiling water, warm water, and take some spice like song we get, or like cinnamon we have, or like fennec seeds or coriander seeds. Just crush it and or ajwain, we can have it. Or tulsi, if it's available. Take one or two tulsi, not daily basis. Occasionally you can have. It's known as Ushnodada. So in winters, if we have it on the first time itself, then our body will feel that much comfort. So our body will be so adaptive towards ourselves. That's what these things are going. The great thing is adding dry ginger or even cumin or coriander. That will stimulate your salivary enzymes. That will stimulate your gastric secretions and even bile flows. And modern science have claimed that drinking 150 to 250 ml of warm water in the morning will increase the gastric motility by 30%. So think
Hmm.
how important is to have these things. And when you go to certain journals of gastroenterology, which was even published in later 20s, they have told that the ginger increases the gastric emptying capacity by 25 to 40%. It's not data which proclaimed that thing. It's the journal of gastroenterology says that ginger increases gastric emptying by 25 to 40%. Why you are taking supplements if you have those things in your
Yeah.
home?
Actually, what happened today was my neighbor, she's an MBBS doctor and she's having running nose for the past 2 days.
Mhm.
Today she came to me and asked me that, can you make that tangy, spicy thing that you make? And I'm wondering what is she talking about. I'm just like, what is that? And like with tomato paste. I'm like, rasam? Yeah, my running nose gets cured by that. It's like, okay. That what all it has? Garlic, ginger,
Yeah.
even fennel seeds. All this helps in that running nose. So simple thing as rasam can actually be very effective in that's what we call it, kitchen pharma.
Yes, it's a kitchen farmer. Yeah. What I was proclaiming is also the same thing. So be simple rather than getting these sort of supplements.
So when we are talking about this, like drinking water in the morning, and like nowadays we see there are a lot of trends about various waters that should be drunk in the morning for various diseases. One among them, for which I can say, is lemon water, hot water, lemon for
Yeah.
weight loss. Seeds, yeah, fenugreek seeds, water for diabetes. So, can you suggest like two or three for various diseases?
A very simple hack for these type of weight loss is take some ash gourd. Ash gourds are
Mm,
available everywhere, right? So take some ash gourd, take some ginger. For example, I may say that around 6 to 7 teaspoon of ash gourd, which is being cut into cubes, and one piece of ginger. Blend it very well, stir it, and take that juice consistently for about 40 to 50 days every day morning before having the food. and you can see wonders. And just avoid other beverages like coffee or tea or other things. And just go with these things because as Ayurveda says, the best Valli Bhalanam Sreshtaha Pushpandas. And another one is our cinnamon. Cinnamon is a very, very effective one that can be used as a regulator of your body things. Not that I may think a powder, a half teaspoon or a quarter of a spoon powder can be very effective. Stir it in warm water and have it. You can add a bit of mint, a bit of like pudina or cardamom also you can add, and you can have it. Then you will have those tastes. So these things we have to go and we have to do it. And always remember, eating in its raw form is very good to get the.
So when we're talking about ahara and the patterns of we should eat, I think that in the recent times, the new trend has come up called like intermittent fasting.
Yeah.
There are like 16 hours of fasting and 8 hours of eating window. It varies. You know, some people do it from 10 hours of fasting or 12 hours of fasting. So as a Swastavrita person or from a person from Ayurvedic background, how do you view this intermittent fasting?
Yeah, as you told that it's a new trend or a new one. Actually, it's not a new one, I may say. Ayurveda calls it as Lankana. But
Hmm.
see, the ancient fasting principles were personalized. It was
Hmm.
not time rigid. Always remember that. It
Hmm.
doesn't implies about the timings. It implies about the person who are being used to or who have been advised to do that. So in modern times, when we say about this intermittent fasting, it has so much of benefits. Of course, it improves the insulin sensitivity by 20 to 30%, or it activates your autophagy. That means your cell repair is being, all those things comes. But when we say or think about Ayurveda, it's a method of wrong fasting, I may say,
Hmm.
because it aggravates Vata like anything. So
It can be the greatest villain.
of course, that's what fasting or lankana should be done on a personalized way. And when it comes to women, particularly women, elderly or underweight persons or individuals or even the children, we must be very judicious about that.
Hmm.
Because certain conditions or certain particular, I may say 12 hours or 16 hours, they may fast. But how are they fasting? That's what really means. If you're healthy, do it, no problem. If you are having some disease, be very judicious when you think about these type of fasting. Consult a doctor
Hmm.
or consult a proper physician who have a registered
Hmm.
medical practitioner degree, and then do these things. And when some say that if you are having diabetes also you go for fasting, it's such a ridiculous thing, I may say. For a person who
Hmm.
is having diabetes should consume certain food at least 5 times meal is being advised for a diabetic person. Fasting
Small needs throughout the day.
100%, 100%. Women, elderly, underweight individuals should need very cautious or judicious things. That's why I rather have a key rule. I may say that fasting is according to Agni and it's not according to your clock.
Hmm.
So just,
So,
yeah,
when we're talking about fasting and how the intermittent fasting could be, I think the most important meal of the day, the breakfast that we say, like there are two different concepts, two ends to it. One say that breakfast should be light, you know, like how the foreigners eat, maybe cornflakes or bread toast or maybe a boiled egg. And the other side is that the breakfast should be like a king, you know, it should be full of calories. It should be very elaborate meal of the day because it's the first and the most important meal of the day. According to you, what should be or how does a breakfast platter should be? What is an ideal breakfast platter?
ideal breakfast platter. Yes, eat according to Ragni. I'm again stick upon to that thing. Eat according to your digestive strength because that has to do a lot. Because see, morning the Agni will be moderate according to Ayurveda.
Hmm.
That means it will not be in its maximum peak. So what you have to do, just think if you are eating a heavy breakfast, does the digestive fire will be lit up or it will be curved off? Of course, it will be curved off. So increase in digestive agni or digestion, we can see, then go for so much of food. That means light nutritional breakfast always improves your cognition. That's for sure by 15 to
Mm,
20%. That's why it's been told that it should be just like king.
mm,
Because your cognition should improve, right? So
mm,
if you are judicious enough that the light nutritious breakfast can improve your cognition even by 15 to 20%, and it can even stable your blood sugar level. That should be good, right? So the ideal platter should be, it should be bit warm, it should be very light, and it should be very nourishing, and it should be digestible. Like that platter, if you set and if you eat, whether you add X, Y, Z, it doesn't count. So it should be very light and it should not harm the digestion that much. So light, nutritious food is very good to eat. Like, for example, if we say that if you have mentioned about food and all those things, right? So how
mm,
much food you have to take? Five, six, or seven will not be ideal. If you take one big small portion along with that, a bit of moong or a bit of we can say protein, a bit of one or two cashews, or a half glass of milk, or one
mm.
boiled egg. All those things will serve the matter. So the number or the quantity is precise there, or that precision should be very favorable for that body. And it will vary from one person to another. If I'm a person who is having 175 centimeter height with the kgs of weight, so you have to think about your height, your weight, and your BMI also. Then you have to standardize your foodings. So an ideal breakfast plate should be warm, light, it should nourish, and it should be digested. These four things you must take care of.
Keeping all these things in criteria to conclude, it should be like breakfast, should be like your personal life. If you are the king, what all things should be best for you in a light manner. It should be best of both worlds. It should be light as well as it should be like a for a king.
Yes, exactly.
Okay, good. So now I think one of the major problem that today's world is facing, that whenever we discuss about dinacharya, like in our last podcast also we said that for a person who's going out the door at
Mhm,
9 a.m. and he's getting up at 8, it's
mhm,
very difficult for him to follow all these rituals.
mhm,
So we are all running in a very busy time constrained life. I
mhm,
think
mhm.
that's the how the world works now. So, what is a simple Ayurvedic self care routine that you would say, like Usha Panam? It doesn't take that much of time,
Yeah,
and what like that? What is a simple Ayurvedic self care routine that you would say for a busy man or a busy?
just think about your tongue cleaning. Tongue clean means oral hygiene, I must say.
Mm,
Because if you are consistently doing it, it will reduce your oral bacteria for about 45%. 45% oral bacterial reduction will be there. So that's the first thing that we have to do. The second thing is very simple, warm water sipping. It improves the gut mobility for sure. So 1 minute, just go for your oral hygiene. Just 1 minute, go for your gut with warm water. And the third and the simple one is a 2 minute deep breathing.
mm,
Just deep breathe for 2 minutes.
mm,
And interestingly, I may say that some studies says that it lowers your cortisol by about 20%
mm,
when you deep breathe for 2 minutes. So 1 minute, 1 minute, and just 2 minutes. Almost it's about 3 to 4 minutes when you keep in your busy schedule also. It's less than 5 minutes, right? So you can easily do that
mm.
one. So give
I
your
think we can only have five
decision
minutes to spare from our daily life for us.
100%. Give your precision for your mouth. Give your precision for your gut. Give your precision for just your breath. These three things. One more thing. Consistently, you have to. So
Mm.
Ayurveda always implies in consistency, not complexities. You have to do
Yeah, because
that.
I said at the beginning, it's a science of life, not just a quick remedy.
100%, 100%, 100%. That's what consistency is the key, not the complexities. So you must be very, very, very judiciously taking in care about these things, no?
Okay, so while we're talking about lifestyle and everything. Epidemic that is spreading these days is obesity. Even I'm no from that, even I'm facing it. So, how does Ayurveda approach weight management? Like, how is it possible to Ayurveda?
That's what I told. Ayurveda always focuses upon metabolic corrections, not
Hmm.
the calorie countings. That's
Hmm.
what. Right. It's not about the
Hmm.
calorie counting, how much calorie you are eating. It's not about that. It's just about the metabolic corrections. Metabolic corrections means the key principles again comes like strengthening your digestive fire, of course, and
Hmm.
get rid of your metabolic toxins. In Ayurveda, it's known as ama. So removal of ama and balancing of two of its main things like kapha and vata.
Hmm.
These three things, if does properly, I'm saying the very base about it. I'm not at all entering into the food. I'm not at all entering into all of those concepts. There are just three basic things that you have to do. One is to strengthen your agni, your digestive fire. Second is to strengthen your ama, the metabolic toxins, or remove those ama. And we know ama what it does. And it's a
Yeah.
huge concept. It's a basic concept that every one of us knows. And balance your kapha and vata. These three things, no, when it comes, it will uh, be the key, according to Ayurveda, for these type of weight reduction. And when we think about the modern, the studies shows that the digestion improves, or the um, correction digestion improves fat metabolism by 25 to 30%. If you have a proper
Hmm.
digestion, the
Hmm.
improvement of fat metabolism is from 25 to 35%. And the sleep time, that's very important. Sleeping and meal timing per induction of your food.
Hmm.
That's also very, 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 very important thing. And more than everything, your stress management.
Hmm. I think
Yeah.
that also plays a very important role these days.
Then you can count for your calories. Think about all these things and then go to count your calories. So that's what I said that I will always ask that why is fat accumulating? Why is fat accumulating? And it's not how much fat you should eat. So that's what
I
we
think a lot of listeners will be very happy to learn that Ayurveda doesn't count calories; it sees the metabolism. So
100%.
nowadays, the as again the trend of macro and micronutrients, this much of protein, this much of carbohydrates, this much of this much. I think it's confusing the whole world. Like, wow, what to do? So yeah, I think that was a really good perspective of Ayurvedic waste management. It requires a lot of deep discussions. So we will definitely plan another session for only dedicated to that because the concept of, as I know, but many of our listeners won't know, the concept of ama, the concept of agni, or the concept of doshas are not small. I think they are the core concepts and the bread and butter of any Ayurvedic physician to know these things. So it is a very vast, vast topic, and I think it only these three topics require three different hours to discuss upon, like three different podcasts. So I will definitely plan those. But now coming to today's topic, from brush to bed. Since we have talked about the brush or the early morning routines or what should be eaten, how it should be eaten. Now let's come to the other end of the day, like the night, when the person completely exhausted from the day work, or from the 9 to 5 job, or from the clinic, or from school, or the mother is tired running after the children. The night, what are the how does sleep positively affect a person's health or a health? What are the factors that one person should have a good night's sleep? How can you improve your good night's sleep?
that's it, right? So Ayurveda always says that if you need a very good, superb sleep, you should think about your food.
Hmm.
You must carry your food. Just think how many of us are carrying our food. Even though that's carrying you all the way, how much of us are caring about our food? Not the food, it's the foot, right? Don't confuse with the words. Food. So food must
OOT,
have FOOT, not the T.
not D. Everyone is concerned about the D, not the T.
Yes, everyone are concerned about the D, not the T. So sometimes please do consider about the tea. And that tea can do wonders for you. Just massage those tea, foot massage. Or Ayurveda have a great word known as Padapinga. Foot oiling, we can say, right? Foot oiling, yes. So Padapinga is very great thing that can induce your sleep. And to your or to everyone's knowledge, I may say that a recent study emphasizes that oiling in your foot can activate the parasympathetic nervous system. So they are coming to that. Yeah, let them. So, and also the sesame oil or the sesame oil or the tila taila can reduce the sleep latency by about or up to 30%, it says. So 30% it will reduce the sleep latency if you use sesame oil. And it increases what the parasympathetic nervous system also. So it will cool off your thing and it will get that stress induced things also. Padabhyanga is one of the greatest thing that you can do, and you can also take some techniques like hot water and cold water immersions after doing the Padabhyanga. So those things will add upon to these matters and it improves simple the melatonin secretion. And if melatonin is secreted, you will get proper sleep. So what we may say that just avoid all those humongous foodstuffs when you have or when you go to bed. That means late dinners you should avoid and just avoid the screens after 9 p.m. That's a very great thing that you have to do if you want to get good sleep. The screens after 9 a.m. And if possible, don't have any sort of mental stimulations at night, like overthinking, thinking about those things, sleep intolerant. Then go for these hacks. It's very simple. Do it. It doesn't do any harm to your body. Just do it. Just know it and feel it. It was really a very fun discussion from bed to breakfast, brush to bed regarding Ayurveda. Uh, so I think we learned a lot today how our daily routine should be, or how it the new trends in our new trends in the social media are not actually good or bad for your health. So it was really good listening to that. Now, as a small session, this time we're not having a rapid fire round. We are having a myths versus facts round. Okay, I'll just say a few quotes or a few sentences regarding Ayurveda. You just have to say if it's a myth or a fact. Having hot water, less honey with lemon on empty stomach can reduce weight. Myth. Having tea or coffee on empty stomach, having ghee will result in weight gain. It's a myth. It is okay to take curd at night. Myth. It's not okay. You should not take curd at night. And if you want to take that too, even on daytimes, just you should be sure enough. You must have certain things like your gooseberries you can have, or amla you can take, or you can take just your peas, or with certain sugar. With that, only you are supposed to take curd according to I. If you are supposed Curd to alone, take. You should not take. You should take it with these combinations so that Abhishindi guna of the curd is counterbalanced. Yes, sure. Milk is best to be consumed at night. Partial myth. Okay, it's a partial myth. Can you please elaborate? Because as concerned with a person, a diseased person, and he needs milk during that time, you are supposed to give him. And he is so much debilitated and he is having so much of problems that then as a supplement, of course, you can give it at any because milk is one such thing, especially cow's milk. After your mother milk, cow milk will say a great wonders for you, but not in heavy quantity. In limited quantities, you have to, and that's why it's known as daily based food stuff, according to Ayurveda. Ayurvedic diets are restrictive. Like you can't have much. There is no options left. Is it restrictive? Myth, huge myth. Ayurveda is only about herbal remedies. 100% myth. So much more as we learned in the past 1 hour. Yes. Okay.
So I think with that, we are coming to end of second episode at Srishti Ayurveda. So thank you so much, Dr. Ankush sir. Again, you have given us such a wonderful hour, and I think you have given me like a few other topics for discussions as well. So I'm really looking forward to pestering you again for another episode.
It's very good to discuss these things, right? So I may say that as we end with this session, Ayurveda is not about changing your life overnight. Okay. Just remember that. It's not about changing your life overnight. It's all about refining what you already do. That's
Mm.
from brushing your teeth to closing your eyes at the night. So that's what we are tending to say to all the audience who are hearing. Ayurveda is not about changing your life. That too in an overnight session. So as I told, just have the consistency. It's refining the things that you already test. Just understand it and be sure that you are getting a reason so that you can research upon it. So reset and then go for research.
Thank you, Doctor. It was, again, as I always say, it was really a pleasure listening to you and having this interactive session with you. So, and I also thank all the audience for showing me such love for the first episode. And I really hope all your support continues. And before we go, please, as I say, please don't forget to subscribe and leave a comment. I will leave all the social media platforms in linked down below. So thank you once again, and see you next time. Thank you.
Thank you. Thank you so much. Take care. Bye.